I started asking people, and I'd go to big hospital systems, talk to the CEOs, and I started asking health ministers and CEOs and doctors and patients about mental health in their countries. Um, and I had this experience in Brazil. I was at a state hospital, uh, middle income country, so it wasn't as bad as the most impoverished places, but it was an interesting experience. And I asked about mental health, so they took me to the psychiatric ward, and they gave me a presentation. And I don't read Portuguese, so yeah, some of the words translate well. They're kind of Spanish, like Chinese. But I didn't really understand what was on the slide. But they had this one slide. There was a series of bar charts, and most of the bars were pretty low, I would say. And then there was one that was way almost off the chart. And I said, well, what's that one? And they said, well, first of all, the chart was average length of stay for various psychiatric illnesses. And for most of them, it was counted in, single digits or maybe low double digits. But the high bar was for eating disorders. And the average length of stay, down to your experience, is not unusual. It turns out globally, when it's really entrenched, it takes months to really break down the disease. And Walter Kay, as you mentioned, he's done some of the brain imaging, and you can see the pleasure center of the brain of a person with an eating disorder light up in response to the behaviors, either the restriction or the converse of that. And so, there are system problems that we've talked about. But there's also the disease itself, Brandon, is really a difficult one. And again, it draws elements of addiction and anxiety and depression, and I think some OCD and other elements that come in and just make it almost a Gordian knot. So in order to get well, a lot of things have to work. We talked about insurance. I think integration of care, like all mental illnesses, is a problem. And it sounds like Donna was too, you're kind of sent out into the wilderness once you leave primary care to figure it out on your own. What's the right kind of mental health care to get? And the profession and the science isn't refined enough now to really give you a guide map like you get when you have cancer now. For most people who have cancer, it's a very predictable path now, but for mental illness, it's still this wild, disintegrated, not comprehensive, not a journey. And that's why insurance has trouble as well.